भारतीय सभ्यता का एक अनमोल खजाना है आयुर्वेदा। माना जाता है कि आयुर्वेदा की शुरुआत ब्रह्मा जी से हुई। ब्रह्म जी ने आयुर्वेदा का ज्ञान दक्ष प्रजापति को दिया। दक्ष प्रजापति से ये विद्या अश्विनी कुमार देवताओं के वैद्य तक पहुंची। अश्विनी कुमारों ने इस ज्ञान को इंद्रदेव को दिया। आज बहुत से अच्छे आयुर्वेदिक चिकित्सक इस ज्ञान की मदद से पूरी दुनिया में लाखों लोगों को आरोग्य लाभ दे रहे हैं। उन्हीं में से एक उत्कृष्ट चिकित्सक हैं डॉक्टर नवदीप शर्मा। डॉक्टर नवदीप शर्मा स्वर्ण मंदिर शहर से जुड़े एक आध्यात्मिक चिकित्सक। आयुर्वेद के अंदर अपनी ग्रेजुएशन श्री लक्ष्मी नारायण आयुर्वेदिक कॉलेज से की, जो हमारे देश के पुराने और प्रसिद्ध संस्थानों में से एक है। यह कॉलेज श्री दुर्ग्याना एजुकेशन फाउंडेशन से जुड़ा हुआ है। उन्होंने मद्रास यूनिवर्सिटी से मास्टर डिग्री की है। उन्होंने मानसिक रोगों में आयुर्वेदिक जड़ी बूटियों के उपयोग विषय पर PhD की है। आयुर्वेद को बढ़ावा देने और दुनिया के अलग अलग देशों में आयुर्वेदिक इलाज और पंचकर्मा केंद्र शुरू करने के लिए उनका नाम वर्ल्ड बुक ऑफ रिकॉर्ड्स में शामिल किया गया है।
डॉक्टर नवदीप शर्मा को दुनिया भर में आयुर्वेद का जागरूकता फैलाने के लिए सम्मानित किया गया। लंदन में इंडो यूके लीडरशिप समिट में द वर्ल्ड बुक ऑफ रिकॉर्ड्स ने दिया उत्कृष्ट पुरस्कार।
ब्रिटेन में बसा भारत का डंका, नवदीप शर्मा और डॉक्टर मोनिका शर्मा को मिला आउटस्टैंडिंग कॉन्ट्रीब्यूशन टू आयुर्वेदिक हेल्थ सर्विस पुरस्कार।
लंदन में इंडो यूके लीडरशिप समिट का आयोजन, आयुर्वेद को लेकर जागरूकता पर जोर, द वर्ल्ड बुक ऑफ रिकॉर्ड्स इन लोगों को किया सम्मानित।
डॉक्टर नवदीप शर्मा को अखिल भारतीय आयुर्वेद महासम्मेलन द्वारा प्राणाचार्य की उपाधि से भी सम्मानित किया गया है।
आयुर्वेदिक डॉक्टर नवदीप शर्मा को युवा प्राणाचार्य की उपाधि दी गई। भारतीय आयुर्वेद महासम्मेलन में सम्मानित किया गया। कार्यक्रम में मनोज तिवारी मौजूद रहे।
नवदीप शर्मा को विश्व प्राणाचार्य भारतीय आयुर्वेद इन मनोज तिवारी भी शामिल हुए।
Up next, most trusted Ayurveda-based healthcare brand of the year, and it goes to ND Care Nirogam Private Limited. Dr. Navdeep Sharma, Director, to please join us on stage.
देखिए, अटल बिहारी वाजपेयी जी हमारे लिए बड़े ऑनर्ड हमारे प्राइम मिनिस्टर रहे हैं, बहुत बड़े लीडर रहे हैं और उनका अवार्ड, उनके सम्मान में किए गए समागम में अवार्ड मिलना अपने आप में बहुत मायने रखता है।
ब्रिटिश संसद UK में आयुर्वेदिक सेवाओं में उत्कृष्ट नेतृत्व के लिए ND केयर निरोगम प्राइवेट लिमिटेड की ओर से डॉक्टर नवदीप शर्मा और डॉक्टर मोनिका शर्मा को कमेंडेबल ग्लोबल रिकॉग्निशन अवार्ड प्रदान किया गया। डॉक्टर नवदीप शर्मा को ऑटिज्म और मानसिक स्वास्थ्य के इलाज में बेहतरीन काम के लिए इंग्लैंड की इंटरनेशनल बुक ऑफ ऑनर में सम्मान मिला। इसके अलावा जयपुर में हुए राष्ट्रीय आयुर्वेद महोत्सव में उन्हें बेस्ट हेल्थ केयर लीडरशिप अवार्ड से भी सम्मानित किया गया। आयुर्वेद केवल उपचार नहीं, जीवन जीने का संपूर्ण विज्ञान है। इसी दृष्टि से डॉक्टर नवदीप शर्मा ने मानव स्वास्थ्य पर महत्वपूर्ण पुस्तकों की रचना की है। उनमें से कुछ का नाम है ऑटिज्म अनफोल्डेड, आहार, द सीक्रेट साइंस ऑफ नरिशमेंट, ब्रिजिंग हीलिंग सिस्टम्स। कई महत्वपूर्ण भारतीय सरकार द्वारा आयोजित अलग अलग प्रकार के कार्यक्रमों में उन्हें आमंत्रित किया जाता है, जहां वे अपने कीमती समय में से समय निकालकर भारत सरकार की विभिन्न परियोजनाओं का अंग बनने के लिए तथा अपने कीमती सुझाव देने के लिए सहभागिता जरूर करते हैं। इन्हीं में से कुछ है। उन्हें माननीय श्री प्रतापराव जाधव जी, राज्य मंत्री स्वास्थ्य से मिलने और आयुष क्षेत्र को आगे बढ़ाने के लिए साथ काम करने का सम्मान मिला। माननीय श्री सर्बानंद सोनोवाल जी, आयुष मंत्री से प्रेरणादायक विचार साझा करने का भी उन्हें अवसर मिला। समग्र स्वास्थ्य को बढ़ावा देने के लिए योग पार्क के निर्माण हेतु आयुष मंत्रालय के साथ मिलकर काम किया जा रहा है। डॉक्टर नवदीप शर्मा PhD CCI की बैठक में शामिल हुए, जहां आयुष के विकास के लिए बेहतर निर्यात नीतियों और वैश्विक मानकों पर चर्चा हुई। आयुर्वेदिक स्वास्थ्य और मेडिकल टूरिज्म में उत्कृष्ट योगदान के लिए उन्हें पंजाब के पर्यटन मंत्री श्री तरुणप्रीत सिंह सोंधी जी द्वारा सम्मानित किया गया। PhD चैम्बर द्वारा आयोजित पंजाब फार्मास्यूटिकल कॉन्क्लेव 2024 में डॉक्टर नवदीप शर्मा को विशेष रूप से आमंत्रित किया गया। माननीय स्वास्थ्य मंत्री श्री बलबीर सिंह जी के साथ डॉक्टर नवदीप शर्मा आयुष मेडिकल वैल्यू ट्रैवल समिट 2024 मुंबई में विशेष अतिथि के रूप में शामिल हुए। डॉक्टर नवदीप शर्मा को आयुर्वेदिक फूड इंडस्ट्री में उनके योगदान के लिए उज्जैन में ऑल इंडिया आयुर्वेदिक कांग्रेस द्वारा सम्मानित किया गया। उन्होंने फाइम मियामी 2022 और PHDCCI की 37वीं एम्बेसडर्स मीट सहित कई अंतर्राष्ट्रीय मंचों पर भाग लेकर आयुर्वेद को दुनिया भर में प्रस्तुत किया। हील इन इंडिया द्वारा भी उन्हें प्रमुख और
A very good afternoon to all our viewers from UK and a very good evening to all of you from India. A very good morning to all of you from US, Canada and other parts of the globe. नमस्कार, मैं डॉक्टर नवदीप शर्मा एक बार फिर दोबारा से आप सभी के सामने हाजिर हूँ और आपका स्वागत करता हूँ हमारे इस लाइव इंटरैक्टिव सेशन का। As always, we try to take the maximum of your questions and generally we try that we take a important topic of discussion with you guys so that majority of you can take benefits out of those. So today, one of the most important topics before I proceed to your questions, definitely all your questions are important for me and I'll be taking those questions one by one. But before I move to those questions, a very important thing over here is that how to take the maximum benefits of your meet, of your face-to-face interaction with me or my team. And why that meet is so important. Had it been easier to do everything online, had it been easier to bring children out of autism merely by giving them certain herbs, that would have been the easiest of tasks for us. And in that case, we wouldn't have required to carry out so many meets, so many interactive sessions, so many OPDs. But the reality is that if we really want a child to come out of autism, it becomes so very important that there is a physical interaction wherever possible with the child. And not just one physical interaction with the child, but every 6 months, that interaction is really very important. Because each and every aspect of your child's behavior is really very important to be observed. If you believe in my words that autism is a temporary phase in the life of a child if treated timely, I appreciate that belief of yours, but I need to be living up to that belief of yours. And for that to happen, it becomes very important that we are not targeting 80% improvement, we are not targeting 90% improvement, but we are targeting 100% coming out of this phase in the life called autism. So that's why it becomes so very important that when you are going to meet me or any of my senior doctors in any upcoming meet, there are certain points which you should not miss. At times the parents, they don't send the videos in a proper way. Now those videos are really an insight into your child's behavior. At times people say that parents feel that the same insights can be taken from the parents by asking questions. Yes, your observations as a parent are really very important and that's why we also have a history taking session. That's why the psychologist who is working for your child's psychotherapeutic analysis is also taking feedbacks from you. But then those are your observations of your child's behavior. From a psychological point of view, there are certain things which you may miss and there are certain things which you may interpret in a wrong way. So if we believe on your interpretations and accordingly we start the treatment, accordingly we go ahead with the treatment, it will be partial recovery. So that's why it becomes so very important for my team to be taking those videos. So that's why the first part of your interactive session with me or any of the senior doctors involves a psychological assessment. Questionnaire is asked. Multiple questions are asked from you as parents, and while those questions are asked, you are asked to share certain videos in regards of the hyperactivity of your child, certain videos showing the name response, certain videos showing the eye contact, then certain videos which show the social interaction and various other aspects like speech and other things which you want us to target and which you feel are deviated in case of your child as compared to any other child. So for us to understand each and every aspect so that we can fix up our targets, we can give you a time frame, we can exactly know what are the strong points in the child's behavior and what are the weaknesses in a particular child. It is so very important that we are given the exact behavior patterns of the child. So that is so very important. As a result of that, when our team approaches you before any video conferencing session or any meet or any OPD, like we are having an upcoming OPD for our Delhi patients, It has been a long demand from our Delhi patients that we are not keeping any interactive sessions at Delhi. So, since we are always also looking at opening up a special training, special education center at Delhi, we decided that let us start it from a humble beginning through a meet. So, one OPD session is fixed up for Delhi, and that will be preceding my visit to UK. So, before I move to UK for the meets under Dr. Divakar Shukla, one of the senior psychologists over there in the Omnia Healthcare Center. So, before that is done, we are having a OPD session over here in India, in Delhi, preceding that session. So, any of you who wants to visit Delhi, who is there in Delhi, you can meet the team, and please, you need to make it quicker, because with less number of days left in that session, this first part, which is very important, the psychological assessment part, many of our psychologists are already busy in taking assessments for the upcoming UK meets, for the upcoming Dubai meets. So that's why it becomes very important that if any one of you is from India and you are willing for the Delhi interactive sessions, you need to contact the team on immediate basis, because then they will also need some videos, assessment through you, and that needs to be then compiled. And once that psychological assessment is done by my team, this is then followed up by an Ayurvedic assessment, where an Ayurvedic medical expert comes in contact with your child. He analyzes the body type of your child, the dosha aggravated, other aspects of medical history of your child, and they are all very important for us to know that what was the underlying reason for that autism. And that really forms a base in the upcoming treatment. Along with that, we also need to be understanding if any kind of medical treatment has already been carried out. So that again is very important, and that is again compiled. Now both those compiled, the behavior part, the medical aspects, are then summed up in a 5 to 7 minute video with the comments of our psychologists, with the comments of our Ayurvedic doctors, using AI tools to ensure that when you are there with me for that 15 minutes interactive session, I know 15 minutes are too less for someone who travels, is there with me, has given so much of time, but believe me, I always ensure that those 15 minutes really count. And by the grace of Almighty, most of you, when you meet me for those 15 minutes, at the ending of those 15 minutes, most parents are satisfied. They know that we made every 15-minute count. Each and every aspect of behavior is covered, the treatment is planned, the same is guided to the team, and then from there on, the team takes care. So, to make your meet fruitful, to make your OPDs fruitful, please do ensure, do not leave it to the last hour that you are booking up your meets, you are booking up your OPDs, because if you are doing that, first of all, you won't get the favorable slots. The second thing, you won't get the favorable psychologists, because the seniors then will be busy taking histories, taking psychological assessments for the ones who booked earlier. So when we are to meet, just like I myself ensure that every minute should count, similarly you as a parent need to ensure that yes, you make every minute count, and each and every aspect of behavior is shared by you through the videos, through the interactive sessions. Nothing should be missed over there. So that is what I wanted to share with all of you. And the upcoming meets curriculum, as I just mentioned, Delhi, then apart from Delhi, because Amritsar, I am not naming Amritsar, is already booked one. It's already fully booked. So it is now Delhi, and apart from Delhi, it's UK. UK is almost booked, I feel, but I don't know if there are 1 or 2 slots left. You can definitely reach the team. Yeah, there are some slots available for the UAE. So you can meet for the, you can contact the team for the Dubai meet. And as a parent, always remember that meeting in personal is 5 times better than a video conferencing session. A video conferencing session, it's 100 times better than repeating the same kind of medicines which you were guided in the first phase of my treatment, because when I talk about autism treatment, it is always done in phases by me. Every 6 months, separate targets are fixed, separate guidelines are given to the team. So even if you are getting the best of results, which most of the parents they do get, don't carry on with the same things. Don't forget, interaction, meeting is utmost important if we really want the improvement we are expecting in the child. So now coming to your questions, because They are really very important for us. So I'll be starting with the first question now, and the first question which I can see over here is that Jain sir, Jain ji, and team, it is my request to you, for those who are sharing questions with me, do not share the questions again and again. You are making it tougher for me to be checking out those questions. See, it is especially for you. One question should be posted only once. It should not be posted again and again. So दक्षित में मीनिंगफुल स्पीच रिकॉग्निशन नहीं, एक ईयर से दवा एंड एबीए थेरेपी ले रहे हैं, लास्ट जनवरी 19 को आपसे मिलकर आए थे ओपीडी में, सर प्लीज़ गाइड क्या किया जाए। मनीषा ने मुझे बताया है जी कि फरवरी 4, 2025 को आप अमृतसर में मिले थे, और उसके बाद आप चंडीगढ़ में 18 मई 2025 को मिले थे, और अभी तक 25 सेशंस हुए हैं। तो यहाँ पे हम ये करेंगे कि 25 सेशंस है, अदरवाइज अपने आप में सफिशिएंट सेशंस हैं मीनिंगफुल स्पीच को इनिशिएट करने के लिए, अगर बच्चा 3.9 साल का है। तो यहाँ हम एक काम करते हैं, हम आपके साइकोलॉजिस्ट को चेंज करते हैं। तो आप एक बार अपने कोऑर्डिनेटर को कांटेक्ट करिए, हम कोशिश करते हैं कि आपको और सीनियर साइकोलॉजिस्ट देते हैं। राहुल हमारे एक बहुत अच्छे साइकोलॉजिस्ट हैं, लेकिन कहीं ना कहीं पे अगर हम मीनिंगफुल स्पीच में पीछे चल रहे हैं तो हम साइकोलॉजिस्ट को चेंज करते हैं। दूसरी इंपॉर्टेंट चीज़ जो मैं यहाँ देख पा रहा हूँ, ये आपको समझनी भी है, 25 सेशंस 25 सेशंस एक साल में बहुत कम है। अगर हमें लग रहा है मीनिंगफुल स्पीच नहीं आ रही है और मीनिंगफुल स्पीच चाहते हैं, हमें बाई वीकली सेशंस करने पड़ेंगे। और अगर आप मुझे सेकेंड टाइम मिले होंगे, जैसा कि मिले भी होंगे, तो ये मैंने आपको बात डेफिनेटली बताई भी होगी कि किसी भी कीमत पे आप वीक में 2 सेशंस मिस मत करिए। तो बहुत बार पेरेंट्स मेडिसिन के मामले में कोताही नहीं करते हैं, लेकिन सेशंस के मामले में वो कोताही कर देते हैं। मेरी आपसे विनती रहेगी, किसी भी कीमत पे बाई वीकली सेशंस विद अ चेंज साइकोलॉजिस्ट हमें करने हैं। दवाइयों को अभी के लिए जो मैं देख पा रहा हूँ, मैं बदलना हरगिज़ नहीं चाहूँगा। राहुल वर्मा जी, आपने आशिमा ने डिटेल्स बताई हैं, एग्जिस्टिंग पेरेंट्स हैं, एंड यू आर गोइंग टू मीट इन यूके, इट इज़ ऑटिज्म एंड epilepsy. The treatment is already going on, and you have mentioned that after stool smell has reduced, but now parents stopped since deviant Gore's diarrhea. So you can give lesser dosage of enzyme and bowel care if you feel that he had diarrhea. Otherwise, enzyme and bowel care are in fact certain combinations which are very good for diarrhea. If someone is having diarrhea, these will stop that diarrhea. But still, if you feel that way, my genuine suggestion to you will be that you can take it in lesser dosage, but do take it. Don't reduce the dosage. And since we are going to meet very quickly, I am a bit hesitant in guiding you anything very quickly over here in a live session. Let us meet, let us discuss everything so that I can analyze everything and I can guide you up. I really appreciate that you're doing everything in a regular way. Carry on with the same things at 9.3 years of age. Once you meet me, I'll be guiding how to go further ahead in this case. And the next question which I can see over here is from Peaceful Progress is the ID. Hi Dr. Sahab, as you suggested us in the last session that to take Joe out, we did that, took Joe out to my daughter's house and pub on Saturday and Sunday, didn't force him to do anything that time. And that's really good that you did that. And I would also like to know that once you have done that, has the problems improved a bit? That is what I really want to know. And even if he's sitting all day long and even if he's still sleeping in a disturbed pattern, please carry on with the same things. Our first target is to ensure that Joe is not irritated. We need to bring him out of that irritation of his. That is really very important. And carry it on for another week. And avoid pub. Pub was not the ideal choice to be taking Joe. It's something where there is loud music, certain things like that. It would have been really better if you would have taken him to something which is more serene in nature. Going to your daughter's house was not bad, but going to pub, that is something which is not what I generally guide and advise. Taking to something which is more soothing, more relaxing, that should be a better option for us. And try to tire him up. He needs to be tired. For him to be having a better sleep, he needs to be tired. So when you took him to pub even, Did he hit the dance floor? Was there a dance floor over there? Does he likes dancing? So, but carry on in any case with what I guided you. So, going further ahead, and don't be demotivated. As I just mentioned last time around, we have increased the dosage of Brainova DS, but we don't want to be going to that a dosage where we sedate him for initiating sleep in him. So sleep is going to improve. Gradually you will see sleep improving. Try tidying it up. And along with all these things, I haven't got an update that you are taking sessions with Viti, and there have been 4 sessions with Viti. So Ashima, in this case, I would also like to have an insight from Viti on what exact she is following in case of Joe. Ask her to be updating me, and sir, give me some time. Let Viti be reaching me out, and I'll be updating you in that regards also through Viti if something needs to be changed in those ABA sessions also. Going further ahead, जसलीन कौर जी, आपने बताया उसका फेस सूज गया है पूरा और नीला भी पड़ गया था. हमसे स्कूल वाले भी पूछ रहे हैं, पहले तो अंश ऐसा नहीं करता था, अब इसको क्या हुआ और क्यों हुआ दोबारा? बिल्कुल पहले जैसे हो गया है और इसका थूक भी बहुत बढ़ चुका है. नो वी वांट टू रिटर्न वचादी घृतम, वी डोंट वांट टू यूज इट. प्लीज गिव इंस्ट्रक्शन टू योर टीम. सर वी हैव, अरे ऐसी कोई चक्कर ही नहीं है. इफ you feel that vachadi ghritam is not suitable for your child, stop using it, and yes, you can immediately return it. Anything which is not being used by you should not be given to him. Vachadi ghritam is otherwise a medicine which we generally use for initiating speech. But vacha, now vacha is having a property that in 1 out of 1000 cases, vacha can cause a bit of vomiting sensations, and there we stop vacha. So don't give it to your child. We don't need to be giving vacha. He is already taking Brainoir hot sip, then Brainoir concentrated. They are sufficient enough to be taken. Stop a vacha in his case. We don't need to be giving it to him. And another thing which we need to be understanding over here is that in case of Jasleen, have we ever met each other? Now that is something which is again very important for me to understand. Because in 1 month definitely we can't see any results. It takes time. But do remember, I don't exactly remember if we really met each other. If we had, that is really good and it's appreciable. If we have not met as of now, till now, and we feel that at 9 years of age, because 9 years is not a small age. If there are children who are at an age of 2.5 years, 3, 3.5, 4, 4.5 years, there the things are really very easy. But where the age is on a higher side, it's always advisable if there is a physical interaction. Honestly speaking, it is tougher to work on a 9-year-old than working on a 3 or 4-year-old. So, in any case, when we meet a child who is at a higher age, that gives a better insight. And that is what I generally suggest. In any ways, I don't know whether we have met or not. If we have met, it's perfectly all right. Going to the next question. Hello, sir. Good day. Looking for my daughter's age, 4 years, 7 months, in touch with your team. Nikhil, major concerns are that Gautami is the name, 4.7 years age. Speech and language delay is present, lacking understanding and socially two-way communication missing. Hyperactivity is not present over here. So these are some of the details which Nikhil has forwarded my way, and as he has mentioned that hyperactivity is not present. Now that is generally in 20% of the cases of autism when they come to us, there is no hyperactivity and there is a lack of understanding. I would also like to know the medical history of the child, if there has been any MRI which has been done. I would also like to know the birth history of the child. And Nikhil, I would have really appreciated, since they are a new member, you were required to get a history done for them. I sincerely apologize in this case, ma'am. Nikhil has missed out on the proper history in this case, and let our team take an entire history for you. I'll be allocating one doctor, one psychologist. They will be taking entire history, and then in the next live I'll be updating you everything. Otherwise, I don't know from which place exactly you are, because Nikhil hasn't mentioned about that. In case you are from UK, we definitely can meet in the coming meet, but give us some time. Let us have the entire details of Gautami so that I am able to guide you in a proper way. At 4.7 years of age, there is speech and language delay, but the age is really favorable for us. It is above the reflex language development age, but in any case, it is not an age where we cannot bring her out of this phase. So let us have some further insights before I commit you in this regards. And going further ahead, now finally I have history for Gautami. That's good. It was mentioned later on. So just give me 1 minute. 4 years, 7 months is the age, and aggression is 4 out of 10. Eye contact is 8 out of 10. Name responds well to her name. Speech 4 to 5 sentences, irrelevant answer to questions. Echolalia sometimes doesn't initiate conversation. And hand flapping is there when excited. And zones out, gets freeze for a minute or two when asked question by teacher in the class. Since the beginning milestones were perfectly alright, and there was eye contact, there was mingling, babbling, and she was saying one word, later on stopped and just babbling was noted. And I'm also trying to see if there are any reports with us. No, there are no major reports with us. So over here in case of Gautami, majority of the things are positive for us. When we come across children who approach us, many of them are entirely non-verbal, they are hyperactive, they are aggressive. Here, the things are better for Gautami than for the other children. I won't rush out on immediately prescribing the medicines for her, but now that I've acknowledged the entire case, within the next 2 to 3 hours, I'll be guiding my team on what to be started in case of Gautami, and Nikhil will be communicating it to you on my behalf. Don't worry and stay in touch. Keep us updated about everything. John Wick. Hi John, and you mentioned, hi good day doctor, one of my friends suffering from Down syndrome want if Ayurveda can help and needs your guidance. John, yes, Ayurveda can help in Down syndrome. We need to know that whether it is only intellectual trouble which is troubling the child and what kind of muscular disability the child is facing. At times in Down syndrome, the intellectual capabilities will be perfectly alright. So I will further like to have insights into exactly what the child is experiencing, because Down syndrome will manifest differently in different children. So connect the person to our team. You can share the number of your friend and let one of my doctors take the entire history of your child and of your friend's child, and be rest assured we will be guiding the child in a perfect way. The way in which you have shown faith on us, we won't let it down. And the next question which I can see over here is Fiza and Talha sir, age 5 years 10 months, auditory concern solved, 1 week से running कर रहा है. स्पीच के लिए गाइड करें सर. नवनीत इज द कोऑर्डिनेटर, एंड तलहा के केस में ABA सेशंस अभी सिर्फ लास्ट मंथ स्टार्ट हुए हैं मिताली के अंदर. सो बिल्कुल चिंता मत लगाएं सर. ABA सेशंस लेट स्टार्ट होने के कारण ही ये चैलेंजेस आ रहे हैं. जैसे जैसे ABA के सेशंस रेगुलर होंगे आप देखेंगे इम्प्रूवमेंट आपको दिखती चली जाएगी. ABA सेशंस कम से कम वीकली या बाई वीकली हमें मिस नहीं करने हैं. जावेद जी, आपने बताया वासु सर आपके कोऑर्डिनेटर हैं जी, और ब्रेनोआर, ब्रेनोए, वचादिघृतम, ये मेडिसिन देने के बाद इम्प्रूवमेंट कितने टाइम में देखने को मिलता है. और मैं सर यहाँ पे जो मैंने अभी ऊपर गायत्री जी के लिए बताया था, आपकी हिस्ट्री अभी मेरे पास नहीं आई है. आप क्योंकि हमारे प्लेटिनम मेंबर हैं और प्लेटिनम मेंबर्स के लिए हम एक्सक्लूसिव हिस्ट्री जो है वो तैयार करवाते हैं और बिना हिस्ट्री देखे अंदाजे से कभी नहीं बताते हैं. सो वी अप्रिशिएट कि आप हमारे प्लेटिनम मेंबर हैं, और वासु प्रायोरिटी के ऊपर आपकी एक हिस्ट्री करवाएंगे हमारे साइकोलॉजिस्ट से, हमारे डॉक्टर से, और फिर एक बार उस हिस्ट्री को, जैसे मैंने गायत्री जी की हिस्ट्री देखी, उसके बाद मैं नेक्स्ट वीक जो है डिटेल्स इस रिगार्ड्स में दे पाऊंगा. हाई डॉक्टर, दिस साइड रॉबर्ट, वी हैव स्टार्टेड ट्रीटमेंट थ्रू VC and want to meet in person for more improvement for daughter. Now she is going to normal school. Hi Robert, I really appreciate that, and believe us, we won't let you down, and I am myself looking forward to meeting you in personal. And next is Barbara, and through your direction my son Kendrick has the symptoms of autism reduced but speech is still not coming. Can you change his medication if possible so that we can direct everything to speech? Hi Barbara, thanks a lot for joining us, but since I do not have your patient ID right now, so I would really appreciate if you can share the patient ID on the helpline number which is there on the screen, and I will definitely look into that once I get the patient ID, my coordinators will be connecting with me. When it comes to speech, it's not just about changing of medications. More importantly, I would like to know who is your ABS therapist currently from our organization and what is the frequency of therapies that are being going on. And Barbara, I would also like to know you are from which country, because for all of you who are from UK, it was really tough this time around for me with the hectic jam-packed curriculum to ensure that the UK meets are as per commitments. But by the grace of Almighty, I spared out few days so that I can meet, I can keep my promise. And now that I am keeping my promise, I would really like that none of you misses out on that. It's not a case where I can be in UK in near future because my upcoming Australia meets, my upcoming US meets, my upcoming Canada meets, and now that EU has tied up with India, I'm looking forward to some quick EU meets also. So those won't allow me to be in UK at least for next 6 months. It becomes very important that we meet if you are there in UK and if the treatment is under us, or if you are planning for a treatment under us, because otherwise it won't be possible in UK. There are some other questions over here, but time doesn't allow me to be going ahead with those questions. I could acknowledge those questions. Neelam ji, Swati ji, Sutapta Mondal ji, I really appreciate your questions, but I really am sorry about that today I have to rush for a quick meeting. So it was a time-bound meet today. I'll be meeting you for sure on next Wednesday, and I'll make sure that it is an extended session and none of your questions is missed. So all of you who joined us today, I really thank you from the core of my heart, and I really believe that with the support of God that Almighty and with the best of your support, like a good parent, following everything that we are guiding, autism must become a temporary phase in the life of a child. Thank you for joining us. Stay wrist pushed. Namaskar.
According to Ayurveda, our Panchabhautik body is an amalgam of space, air, fire, water, and earth.
Meet Dr. Navdeep Sharma, a visionary Ayurvedic physician, researcher, and healer.
Ayurvedic treatment rests on three powerful pillars: Daiva Vyapashraya, Yukti Vyapashraya, and Sattva Vajaya. I try to combine all three of these approaches for the treatment of children suffering from autism. Sattvajaya Chikitsa is a form of treatment that includes modern-day psychotherapy within it. Being a D.Litt scholar with PhD in role of Ayurvedic herbs in psychological disorders, as well as a dedicated researcher, it has been comparatively easier for me to apply Ayurvedic Sattvajaya Chikitsa in integration with Yukti Vyapashraya Chikitsa with greater precision and effectiveness. This combined approach has been consistently used by us in the management of children suffering from autism. In addition, selected aspects of Deva Vyapashraya Chikitsa have also been incorporated wherever appropriate. I would now like to present one case study to begin with.
Autism is a temporary phase in the life of a child if treated timely.
This is the case study of Parth, a 3-year-old child diagnosed with autism. At a very young age, Parth showed multiple developmental challenges. Chief complaints: speech delay, hyperactivity, irritative behavior, less interaction, poor understanding. Parth's detailed medical history was documented and evaluated before initiating treatment. In April 2023, Parth's parents consulted Dr. Navdeep Sharma and felt confident about the scope of treatment. A personalized Ayurvedic treatment approach was planned using specific herbal formulations to support neurological development. Braino R Plus, supporting attention and neurological response. Braino R enriched with Mandukparni, Kushman, Ashwagandha, Amlaki, Jatamansi, Sarpagandha, and Ustaculus. Braino A Plus, supporting calmness and behavioral balance. Braino A enriched with Shankpushpi, Brahmi, Shatavari, Bringraj, Shunti, and Vacha. Cucurbita oil, supporting nourishment and neurological health. Mukta Pishti, supporting mental stability and reduce irritation. Before treatment, Parth often showed irritative behavior and did not respond clearly to instructions.
आ जाएगा वो.
Within 9 months of undergoing treatment from Dr. Navdeep Sharma, Parth showed significant improvement.
कलर करो. वेरी गुड पार्थ. कलर करो. नो, इस हैंड से करते हैं. इस हैंड से, राइट हैंड. वेरी गुड. इसके अंदर रख दो. वेरी गुड. पापा का हैंड, दीदी का हैंड करो. वेरी गुड पार्थ. चलो. वेरी गुड. खाओ. वेरी गुड. पार्थ तो बहुत कम.
Hello parents, Parth, say hello. This is Parth, my son, he's about to turn 4 years old. Last year in July we went to Dr. Navdeep Sharma sir. A sir had told me about him. We never imagined that in just 9 months Parth would start saying mama and papa to us so soon. As a mother, as parents, we always longed for the day when we would hear Parth say mama and papa. Today Parth says mama, papa and everything else with understanding. By God's grace and with Sir's medicine and guidance, in just 9 months, Parth is now living a near normal life. And Parth was also in playgroup at school. Just 15 days ago, the teacher at school said that Parth will be moved to nursery, and the happiness that Sir has brought into our lives, what more could parents ask for than to see their child improve so quickly and so well? For parents, this is truly a big thing. Thank you, Sir. Thank you very much for bringing such great happiness into our lives. Thank you, Indian Roga.
Call now to connect with Dr. Navdeep Sharma and gift your child autism-free life.
According to Ayurveda, our Panchabhautik body is an amalgam of space, air, fire, water, and earth.
Meet Dr. Navdeep Sharma, a visionary Ayurvedic physician, researcher, and healer.
Ayurvedic treatment rests on 3 powerful pillars: Daivavyapashraya, Yuktivyapashraya, and Sattvavajaya. I try to combine all 3 of these approaches for the treatment of children suffering from autism. Sattvajaya Chikitsa is a form of treatment that includes modern-day psychotherapy within it. Being a D.Litt scholar with PhD in role of Ayurvedic herbs in psychological disorders, as well as a dedicated researcher, it has been comparatively easier for me to apply Ayurvedic Sattvajaya Chikitsa in integration with Yuktivyapashraya Chikitsa with greater precision and effectiveness. This combined approach has been consistently used by us in the management of children suffering from autism. In addition, selected aspects of Deva Vyapashraya Chikitsa have also been incorporated wherever appropriate. I would now like to present one case study to begin with.
Autism is a temporary phase in the life of a child if treated timely.
This is the case study of Parth, a 3-year-old child diagnosed with autism. At a very young age, Parth showed multiple developmental challenges. Chief complaints: speech delay, hyperactivity, irritative behavior, less interaction, poor understanding. Parth's detailed medical history was documented and evaluated before initiating treatment. In April 2023, Parth's parents consulted Dr. Navdeep Sharma and felt confident about the scope of treatment. A personalized Ayurvedic treatment approach was planned using specific herbal formulations to support neurological development. Braino R Plus, supporting attention and neurological response. Braino R enriched with Mandukparni, Kushmand, Ashwagandha, Amlaki, Jatamansi, Sarpagandha, and Ustaculus. Braino A Plus, supporting calmness and behavioral balance. Breno A enriched with Shankpushpi, Brahmi, Shatavari, Bringraj, Shunti and Vacha. Cucurbita oil supporting nourishment and neurological health. Mukta Pishti supporting mental stability and reduce irritation. Before treatment, Parth often showed irritative behavior and did not respond clearly to instructions. Within 9 months of undergoing treatment from Dr. Navdeep Sharma, Parth showed significant improvement.
कलर करो, वेरी गुड पार्थ, कलर करो। नो, इस हैंड से करते हैं, इस हैंड से, राइट हैंड, वेरी गुड, इसके अंदर रख दो, वेरी गुड। पापा का हैंड, दीदी का हैंड पकड़ो, वेरी गुड पार्थ, चलो, वेरी गुड, खाओ, वेरी गुड, पार्थ तो बहुत कम। Hello parents, Parth, say hello. This is Parth, my son. He's about to turn 4 years old. Last year in July, we went to Dr. Navdeep Sharma, sir. A sir had told me about him. We never imagined that in just 9 months, Parth would start saying mama and papa to us so soon. As a mother, as parents, we always longed for the day when we would hear Parth say mama and papa. Today, Parth says mama, papa, and everything else with understanding. By God's grace and with Sir's medicine and guidance, in just 9 months, Parth is now living a near normal life. And Parth was also in playgroup at school. Just 15 days ago, the teacher at school said that Parth will be moved to nursery, and the happiness that Sir has brought into our lives, what more could parents ask for than to see their child improve so quickly and so well? For parents, this is truly a big thing. Thank you, sir. Thank you very much for bringing such great happiness into our lives. Thank you, Indian Roga.
Call now to connect with Dr. Navdeep Sharma and gift your